Hello, my name is Declan and I'm the very proud Chief Executive here at North London Hospice. Our organisation, a charity in the heart of North London, serving the community in Barnet, Enfield and Haringey, was established over 35 years ago in 1984 to serve the needs of the community that we support. Hospice care is very much about holistic care. It's about care for a person at the end of their life and a care that can be provided at any time during that journey. So we are a charity and very much we welcome the support we get from the community. It costs over £13 million a year to run the hospice, and 34% of that income comes from the NHS. The rest of it is through the generous donations we receive through fundraising, retail, trusts, foundations and legacy gifts. Our charity is governed by our trustees. Our chair, Liz Burgess-Jones, and the rest of our trustees are appointed through a recruitment process to bring skill, knowledge and commitment to the organisation. All of them live within the localities of which we serve, and they're here to support the organisation's strategy, development and growth. I hope you enjoy your journey here at North London Hospice, and I very much look forward to working with you.
Hello, my name is Liz Edwards and I'm the Director of People at North London Hospice. And I'm responsible for people across the organisation. And that includes HR, the Human Resources Service, volunteers, so the volunteers recruitment and support, also clinical supervision and pastoral care. We've got around 250 staff in the organisation, and they're across a whole range of duties and roles. We also have over 400 volunteers, and they are really important in supporting our services, whether it's front of house or on IPU or in retail, where the shops are mainly run with volunteers, so very, very important. We want to support you in your career development while you're working with us at North London Hospice, whether you're a staff member or a volunteer. We do have a range of mandatory training, which is actually online or face-to-face, but we do offer a whole other range of training opportunities. So we do really want you to be developing your career. Also, as an employer, we have just signed up to the Wellbeing Pledge, and we've actually trained a number of staff to be mental health supporters across the organisation. And we've committed to providing a full range of other resources to staff and volunteers to support their mental health. We also do offer EAP, which is an employee assistance programme. I'm showing you this card because for staff, this would have been included in your induction pack. And through this service, you can have by telephone or on the website access to a full range of advice and guidance, but also 6 face-to-face counselling sessions. So please do remember that if you feel that you need advice or support as you continue to work for us. So welcome, and I really hope that you enjoy your time with us.
Hi, my name's Dr. Sam Edward. I'm Medical Director here at North London Hospice. I'd like to welcome you and tell you a little bit about the care that we provide across our services. We work really hard to provide individualised care for people with reference to the things that are really important to them. We support people both at home and in the community and on our inpatient unit. We have 18 inpatient beds, so that's really just a small proportion of what we do on the inpatient unit. We also try and make sure that we look after and support and provide education to family, friends and people's support network and the professionals involved in their care, and we provide 24-hour telephone advice and support. We may care for people for sometimes weeks, months, or even years, and sometimes even just days at the end of their life. Sometimes people think that hospices are just places where people may choose to die, and certainly we do support people around the last days of their life, both at home and on our inpatient unit. But we also aim to help people with quite severe symptoms. So we really do hope that we are able to improve people's symptoms and sometimes be able to get them home to live their lives well.
Hello, my name's Marion and I'm a volunteer here at Finchley on front of house. I work based at this desk here, usually with another volunteer. Today it's Pam. We meet and greet visitors and show them where they need to be in the building. We do 4-hour shifts between 8 in the morning and 6 in the evening. Behind us is a lovely bright seating area with a view of the pretty courtyard garden. Over here we have a further seating area where you can sit and talk quietly, and a room of quiet where you can sit in complete privacy. Over here is the coffee shop where we serve hot and cold drinks and snacks. I've been a volunteer here at front of house for 2 years. I really enjoy working here and I enjoy contributing to my local community.
Hello, my name is Miranda and I'm the Assistant Director for the Inpatient Unit at North London Hospice. So I'm going to take you through the unit and tell you a little bit about it as we go along. First thing to say is that there are 18 beds. They're all in single rooms and each room has its own bathroom. Some of the rooms also have access to a patio that leads onto our communal gardens. Some people come to us directly from home and some people come from hospital. Some people come here for end-of-life care in their last few days or weeks of life, and some people come for management of their symptoms. And these could be symptoms that are physical, for example, pain or nausea, or they could be emotional distress, psychological symptoms. And we have found that with the right care and treatment, these people are able to return home.
Hi, my name is Robin and I'm the Director of Fundraising and Communications. I've been working at the hospice for 9 years and we, as a charity, rely on our community to fund our services. In fact, we have to raise £3.6 million every year from our community, which is split between arranging a number of events or going to our community for trust and grant making foundations or writing appeal letters, as well as legacy gifts and in-memory giving, similar to our tributary here. We're absolutely reliant on our community and always open to ideas, to generate as much money for the hospice. So if you have any ideas or would like to fundraise for us, please come down and see us, and look forward to meeting you.
My name's Mark. I'm part of the catering team here at North London Finchley, and we also look after the catering at the Health and Wellbeing Centre at Winchmore Hill. Basically, we provide fresh home-cooked food for each and every one of you, any time of day, up until 7 o'clock at night. Whether you fancy, a well-done bacon roll or chicken tikka with onion, coriander salad and minted yoghurt, you name it, we can provide it for you. We only use locally sourced suppliers, so everything is nice and fresh for you. Pop down and see us, and if it's your birthday, you don't pay for lunch, it's on us. So, something to look forward to when you come to work on your birthday.
I'm Trudy, the Associate Director of the Health and Wellbeing Centre. The Health and Wellbeing Service offers a multi-professional service in an outpatient and day service facility. We're here to see anybody who has a potential life-limiting illness. That may be a cancer diagnosis or a condition such as a respiratory condition, heart failure, or a rare neurological condition. We aim to enable people to live as well as possible for as long as possible. Our service offers individual activities or group activities, which may be as a course, a workshop, or an ongoing group. We work in 4 areas: symptom management, which may be physical, emotional, or functional; rehabilitation and self-management, and that's keeping people as fit as possible through our exercise groups or learning strategies that help with breathlessness, fatigue, or sleep. We also work with emotional aspects, both psychological, spiritual, social, looking at anxiety, role and identity, confidence and self-esteem. And our final area is our general well-being area, where we give people an opportunity to come and connect with others. That may be through joining our yoga group or mindfulness, or our creative activities such as writing or photography group, singing, or just coming for a coffee and a chat.
Hi, my name is Patrick. I'm the community team lead for the NLH Palliative Care team, and I've worked in the North London Hospice for the past 5 years. We have 3 community teams that cover 3 boroughs. We provide individualised care for people living with life-limiting conditions, supporting patients with symptom management, and also helping them to plan for the future, which is called advanced care planning. Our teams are multi-skilled and are made up of doctors, nurses, physiotherapists, occupational therapists and social workers and healthcare assistants. We work together with our community partners on coordinated individualised care for each patient, such as GPs and district nurses.
My name is Nicola and I work for the social workers team, and I'm the family support worker for the Barnet community and the inpatient unit. The social workers team offers support across the 3 boroughs, and we are the leads for safeguarding and carers. We're able to offer practical advocacy and emotional support to all our patients, families and carers. Within our social workers team, we also have our bereavement service. The bereavement service is able to offer support to all family, friends and carers who have been impacted by the death of someone under the care of the hospice. The support can come in a variety of ways. We can offer face-to-face support, telephone support. We have our walk and talk groups in local parks, bereavement cafes and informal groups. All of these are led by a member of staff or one of our trained bereavement support volunteers. It's important to note that during the pandemic, all face-to-face support has turned to either virtual or telephone support, and our walk and talk groups are happening in line with government guidance.
My name is Catherine and I'm the Retail Operations Manager, and together with my colleagues Sue and Pepe, our shop managers and drivers, we run 18 shops across the boroughs of Barnet, Enfield and Haringey. 2 of our shops are furniture shops, and as you can see, I'm actually in one of our furniture shops at the moment. This building is actually the newest addition to our shops, and it also houses our eBay department and our collections department. And thanks to our customers, donors and supporters, we generate £3 million in sales each year, almost £1 million of which goes to support patient care. Of course, none of this would be possible if it wasn't for the dedication and hard work of all our volunteers. We have over 250 volunteers in retail, and it's thanks to their hard work that we are where we are today. Of course, this last year has been very challenging for us, and our shops have had to open and close in line with government guidance.